Are you ready? Just hello there. Did everyone get a goodie bag? Oh, just the first 50. I'm Debbie Pearson, the chair of the Wellness Committee, and I'm so excited tonight to welcome the dermatologist that Hank and I go to for the good, the bad, and the ugly. It's Dr. Elizabeth Geddes Bruce. I found out tonight for the first time she was born in Canada, so she's a Canadian citizen. And that was new news. But she also told me something a little bit unique that she does, and I don't know where it came from. But she gets clay and makes little bitty miniature food items in clay, like hamburgers and tacos and things like that. And then lets them dry, and she has these little bitty food items. And she showed me a picture on her phone. I wish she had it up here because they're just simply adorable. But she's fellowship trained in cosmetic dermatology and medical dermatology. She was a chief resident at University of Houston and MD Anderson. So she knows a tremendous amount of both the medical side, the cancer side, and the cosmetic side. And I've dipped into both sides, so she really does know what she's doing. She is married, has 3 beautiful children, a husband who's an attorney here, and all of her patients love her. She's done a fairly brief presentation because skincare is so unique that she wanted to allow plenty of time for everyone's questions to get answered. So be thinking of your questions as she goes. Her focus is on prevention of skin problems. And let's give a warm welcome to Dr. Geddes.
Well, thank you for that lovely introduction, Debbie. Again, I'm going to be speaking about healthy skin at every age, and particularly what we can do to make sure that our skin is in good condition as we age. And I thought I knew how to advance this. Hold on, let's see. There we go. Okay, so Debbie gave a great introduction about me. I'm just going to tell you a little bit more, and I promise this talk is very brief, just like she said. So again, I'm Dr. Elizabeth Geddes Bruce. I am a board-certified dermatologist, which means that I first went to medical school for 4 years after college. I completed an internship year in internal medicine, and then I went on to do 3 years to study dermatology specifically, which is the science of treating diseases that affect the outside of the body, diseases of the hair, skin, and nails. So if you have an issue that affects anything of your hair, skin, or nails, a dermatologist is who you'd like to see. After I completed that, I went on to do my fellowship, and I did a fellowship really to focus in laser procedures. So I treated a lot of children with different birthmarks or burns. And also doing some general cosmetics as well. And I practice here in Austin, Texas at Westlake Dermatology. It is one of the largest private practices that's still physician-owned in the United States. Many of the larger practices are now acquired by private equity groups, but this one is still just considered a large private practice. And we have lots of locations all throughout Austin, and it seems like we're growing every quarter. I'm at the location at Far West, which is a little bit, maybe about 10 minutes away from here. There's also another location that's pretty close by, and that's on 38th Street. That's the Lamar Central location. And then just a quick thing, before I went to medical school, I completed a Master's of Science in Human Nutrition at Columbia. And so I also really love nutrition and how we can incorporate it into medicine and prevention and our skin. So that's a little bit about me, and we'll keep going. Okay, I'd like to begin the talk with what I think is probably the biggest, most important topic of conversation, and that is just in general skin cancer. There's a good chance that you or someone that you know or love has had skin cancer, and that's because it disproportionately affects our senior population. We know that the rates are increasing. Every year we see higher and higher rates of skin cancer, and that could be twofold. It could be due to just better detection, and also that our population is living longer, thankfully. Skin cancer, most importantly, is very easy to cure if it's detected early. It is a simple surgery, a simple procedure, and then you are good to go. If it is something that is neglected or not found or continues to grow, then the risk happens that it can spread, and that's when it can really be life-threatening. Things that I want you to look out for on your own skin or someone that you care about that might suggest that they might have a skin cancer are these 4 things. We used to say the A, B, C, Ds, but those really weren't great criteria. Most importantly, you're looking for something that's changing. If something is cancer, it's not going to stay the same on your skin. By definition, it's going to grow unregulated. And so the spot that might be cancer will be growing in size. It might bleed easily. It might fail to heal. So often patients think that they have a pimple or an acne bump or a sore spot, or maybe they scrape their head in the shower or on a door hanger if they're tall or something like that. But if that spot does not heal like it normally should for you, that should clue you in that this might be a skin cancer. And the other thing is that skin cancers are often multiple colors. And I'll show you some examples of our most common skin cancers. We actually have lots of different types of skin cancers, but the 3 most common are the ones here on this slide. The first most common skin cancer is the basal cell carcinoma. About 1 in 5 Caucasians will develop a basal cell carcinoma within their lifetime. 90% of those skin cancers will happen on the face or neck. Basal cell carcinomas are specifically related to sun exposure. So the more sun exposure you've had over time, the more likely that you'll develop a basal cell carcinoma. They often look like this picture. Can you see that from here? No. This one on the top left. They're often clear. So it's not infrequent that I find the basal cell on a patient that they weren't aware was present. The good news about a basal cell is that they rarely, if ever, metastasize, meaning they usually just stay in that one spot and continue to grow. Now, if this is near something vital, like an eyelid, or a nose, or an ear, or a lip, then it can cause significant disfiguring issues if it's not caught early. But it's unlikely to ever spread to the lungs or anything to take your life. The next most common skin cancer is a squamous cell carcinoma, and that's the picture on the top right. You can see that sometimes they are hot pink and scaly. Now there's some very normal skin findings that look like that as well, but in general, if you have a spot pop up like this, it's worth getting it checked out. Squamous cell carcinomas actually kill more people in the United States than melanomas, which is the next most serious skin cancer. Just by sheer number, squamous cell carcinomas are very common, and if they are located on a place like the ear or the lip, they're higher risk of spreading to areas like the lungs, the lymph nodes, things like that. The third cancer that we really hate to ever diagnose in someone, but it happens, is a melanoma. Melanoma is a funny type of cancer because we cannot treat it with traditional chemotherapies. Melanoma is really a type of cancer that evades the immune system. So the immune system just ignores it. So if it becomes advanced, we have to use medications that alter how the immune system recognizes it. It is a skin cancer that arises from the cells that make pigment in our skin. So if you have a mole that you've had your whole life, but it starts changing, that's a risk factor that it could have become a melanoma. Most melanomas, however, come up on unaffected skin where you didn't have a mole. And it would present as a dark spot, and it might have different colors and irregular shapes, and it will grow. Melanomas do not stay still. Also, I think something that patients often misunderstand is that they think that a skin cancer has to be bumpy. And so often someone will come to me with concern of a mole that is bumpy or raised. Usually a bumpy mole is actually very low risk. Most melanomas start out flat. So just because it's flat does not mean that it's okay. Okay, now some common skin growths. These are things that we see on everyone. These are spots that start growing probably around the age of 30, and they're very common. The top left are spots called cherry angiomas. They're bright red, like a ruby, and they're just collections of blood vessels. They are perfectly harmless, and in some cultures, they're actually considered good luck. You don't have to worry about those. The spot on the top right is referred to as a seborrheic keratosis. These are probably the second most common skin growths that we see on the skin. They are very bumpy and scraggly, and maybe it almost feels like you could pick it off. Maybe you have and it's fallen off. These are harmless skin growths, and despite them looking very dark, they're actually not dangerous and have no chance of turning to skin cancer. Being able to discern that kind of a spot from maybe a melanoma or a harmless mole can take lots of practice and time and study. So if you're unsure, it's never a bad idea to ask a doctor. On the bottom left is something called an actinic keratosis. An actinic keratosis is also known as a precancerous lesion. It might be a little bit pink, and it just feels like rough skin. So if you have skin that feels almost gritty and rough in patches, and it doesn't get better with lotion, there's a good chance that it is actually an actinic keratosis. Actinic keratoses, if they're not treated, can progress to squamous cell carcinomas. And so if you have actinic keratoses when you go to the dermatologist, we'll often treat it with a number of different modalities, depending on how many there are, what your downtime looks like, and your preference. There's liquid nitrogen, which burns the skin and kills those bad cells and gets them over with. There's also creams that we can prescribe that help to take care of them. The last spot on the bottom right are called lentigines. Those are also known as age spots, birthday gifts, wisdom spots. I've heard people say liver spots. I don't even know where that one comes from. But they are collections of pigment in the skin that reflect sun damage. So the more sun that you've had exposure over time, and likely some genetic predisposition as well, you might develop more of these spots. These spots in general are harmless, but they also have a risk of turning into a melanoma. So if you have one brown spot that continues to grow and grow and grow, even if it's flat, it's worth getting it checked out. So how do you get it checked out? Well, when you come to the dermatologist, you can come for a total body skin exam. This is our best method to detect skin cancers. And it involves you coming to the office. You do have to take off your socks and shoes. I need you in your underwear, and we'll give you a gown so you don't get too cold. If you decline us looking in areas where the sun doesn't shine, then we might miss something. So it's important that at least, depending on your risk factors, might be once a year, might be once every couple of years, might be even more frequent than that, depending again on your risk factors. It's important to have somebody come look at you head to toe, go through your scalp, look between your toes, and if you see a dermatologist or maybe an assistant of them, and they do a very quick exam where they just kind of look at you and they don't look at your feet, you need to find somebody else. Okay. The total body skin exam is a physical exam that's covered by insurance. It's not considered a preventative exam, but it is a specialty exam. And I went over a little bit about what's involved. How can we avoid skin cancer? Well, I always tell my patients, what's done is done. You can't beat yourself up about the past. I know back in the days we didn't have good sunscreen. I hear these crazy stories about baby oil and, getting a burn at the beginning of summer intentionally so that you'd be golden brown and all those kind of things. Thankfully, these days we're smarter. This is me with my 3 children. This is how we go to the beach. My children have never worn a bathing suit that wasn't long-sleeved and all the way down to their feet. They're very comfortable that way. It keeps the sand out. They're able to run around, and most importantly, I don't have to reapply sunscreen on them. It's very difficult to do on a child every 2 hours. They're used to wearing wide-brimmed hats and sunglasses, and we just put sunscreen on the areas that are exposed. Using photoprotective clothing, I think, is the #1 important thing to do. Hats, clothing. After that, it's important really to avoid peak hours. So if you are going to be going to the beach, because the beach is lovely, or the pool, or you want to take a walk outside, you should do it. It's important to make vitamin D. It makes you happy. Physical activity is happy. This is part of wellness. But you should not do it at 12 in the afternoon. Right? You should do it early in the morning or later in the evening when the sun has set. That's a way to minimize your exposure to the very strong UV rays. Sunscreen is a little bit of a personal preference when trying to decide what's the best sunscreen. The first thing I like to tell people is the best sunscreen is the one you're going to wear. So if you pick one that has very high protection but feels like Elmer's glue going on your skin, smells terrible and burns your eyes, then you're not going to use it properly, and you'll probably have that one bottle sitting in your bathroom for a couple of years. If you're using your sunscreen appropriately, you'll go through multiple bottles during a trip, and you'll go through multiple bottles even over a period of months, because it has to be reapplied every 2 hours. And what you're looking for at the store is something that says broad spectrum. So broad spectrum means that it covers both UVA rays and UVB, the 2 main forms that cause skin cancer. And you're looking for at least an SPF of 30. But most importantly, you're looking for one that feels nice so that you use it well. And these days, the formulations of sunscreens have improved dramatically. They have quick drying, clear gels that you can use and dry very quickly on the arms. They have these beautiful ones with moisturizers, so you can just put it on your face in the morning and it feels like a nice light moisturizer. And I've included in those bags some samples for you to try of products that I think are great quality. If you want to boost your photoprotection, you can also consider taking a supplement. There is a supplement called Polypodium leucotomos, which is actually a fern from South America. Now, my caveat as a doctor is you should not take this supplement if you have liver disease or a history of poorly controlled diabetes, but generally it's very safe and you can give it to children. It confers about an SPF of 4, And you might think 4, that's so low. But if you're also doing other photoprotective measures, then it might be worth it if you're taking a trip where you will be out in the sun a lot. Having an SPF of 4 means that it would take 4 times longer for you to burn than normal. So it's still a nice level of protection. Okay, switching gears a little bit. I'd like to talk a little bit about overall skin health. Things that you can do to make sure that your skin is optimized to prevent rashes or itching or anything else that might make you feel uncomfortable. One thing of basic skincare is to avoid very hot showers. The number one cause of itchy skin is actually dry skin. And we know that very hot temperature water dries the skin out. Drinking water, hydrating orally, does not moisturize your skin. It's a little bit counterintuitive. If you are wanting, I'm going to skip down to this diet and nutrition. If you're wanting to increase your skin's ability to retain moisture and to prevent becoming dry, you need to work on taking your omega-3 fatty acids. Things like fatty acids are able to improve the composition of the lipids in your skin, which is almost like putting icing on the cake. It prevents it from the water from evaporating out. So yes, you should stay hydrated for normal health reasons, but if you have dry skin, you need to think about, are you getting enough good healthy fats in your diet? Salmon, avocado, a handful of almonds every day. That will do you much better. Okay, the next thing. People often think that if you have skin that is very sensitive or easily irritated, that you should avoid showering. But it's actually opposite. But we don't want you to take, again, big, long, hot showers. But if your skin is easily irritated by fragrance or things in the environment, then you actually need to rinse those irritants off of you. It's the same thing if you have lots of seasonal allergies. If you are someone who lives in Austin and you get cedar fever and you go outside, that pollen is on your body in some way and you have got to rinse it out. So if you take a daily quick rinse, just make sure that you use a very gentle cleanser. And I've included a little gentle cleanser in the bag. It says shampoo and body wash. It can be used for both. Make sure that you replace the moisture in your skin regularly. As we get older, our body, the lipid composition in the skin changes, and it's not as good at locking in that moisture, and that's where using ointments, creams, and lotions can help moisturize the skin and help prevent itchy skin. Make sure that if you're going to be spending greater than 15 minutes outside, that you do think about actively protecting your skin from the sun. If you're just doing a quick little walk to check your mail or, I don't know, head out and get a few little rays, that's okay. But if you're spending more than 15 minutes, I want to see a hat on your head. Okay, and then again about the diet and nutrition. Focus on your omega-3 fatty acids. Consider antioxidants. When our body gets a sunburn or even just sun exposure where you're making a tan, what's happening is the UV radiation creates DNA damage and our body has to repair it. In order for our body to repair it, it needs fuel, and in order to do that, it uses antioxidants. You can boost your body's response to healing itself by making sure you get enough antioxidants. And the best things to focus on are fruits and vegetables that are colorful. So a handful of blueberries, berries, leafy greens, a red pepper, anything that's brightly colored, you can rest assured that it has good antioxidants. Okay, switching to hair health. What can we do to make sure our health is in good condition? The strength of our hair often reflects our nutritional status. If you have lost a lot of weight, one of the first things that might happen is that you'll start to shed your hair. If you are not getting enough protein in your diet, your body is smart. It knows that it needs to save protein for your heart muscle, for your skeletal muscle, and the first thing it gets rid of is your hair, because your hair shaft is made out of keratin, which is protein. You also have to have adequate iron stores to make good hair, and you have to have enough vitamin D. Most of the time, patients wonder, well, if you're protecting yourself from the sun so much, are you going to be making enough vitamin D? Well, there's been lots of studies on this, big studies, huge populations, and patients who have observed the strictest photoprotective measures do not have a higher risk of osteopenia, osteoporosis, or broken bones. In fact, you need very little sun exposure to make vitamin D, and probably 15 minutes is adequate. But there's some change in the environment where all of us aren't getting what's considered an optimal level. And this affects people of all skin colors, and most people need vitamin D supplementation in their diet. So it might be something for you to consider taking. The one thing to probably run by your primary care doctor is sometimes vitamin D, if it's too high, can increase the risk of kidney stones. So it is something that probably would need to be monitored if you're at risk for that. Your hair does not need daily washing. You probably already know that, but this is just going over hair health. If you are someone, though, who experiences a very itchy scalp, you may need to wash your scalp daily. Dry, itchy scalp is not usually from overwashing. Dry, itchy scalp has to do with an oil imbalance and then yeast overgrowing. We all have yeast all over our body. It's part of our microbiome. We're all just a big walking mass of bacteria and yeast in our own cells living in harmony. If those oils get a little bit out of control, the yeast goes up and it creates inflammation and makes flakes and redness and itching. So if you are affected by a dry, itchy scalp, you will need to wash your scalp more frequently and consider an anti-inflammatory medicine if that's not good enough, which a doctor can prescribe for you. If you use a shampoo, you want to make sure that it's gentle. And if you use a conditioner, its job is to coat the hair shaft so it's less fragile when you're grooming. There's different forms of scalp care that you can consider to improve your hair health. Massage is a very easy way to improve your hair health. And that's because when we massage the scalp, we're increasing blood flow to the area. It doesn't just feel good and help you release endorphins and relax. You're increasing blood flow to the area, which can help with hair growth. And again, this is touching upon, I just want to say, if your scalp feels irritated or inflamed, you may benefit from an anti-inflammatory medicine, which can be prescribed to you by a dermatologist. The last thing you want to think about is protecting your hair. Minimize heat styling as much as possible and avoid harsh chemicals. Last bit is just a touch on aesthetics. Aesthetics in dermatology range from all sorts of things, like I'm sure you've heard about Botox, lasers. What we do often is use these tools to make people feel better about themselves. It is not about trying to look 29. It is about feeling good about yourself so you feel good about interacting with the world. Some of the most common things that I see in a more senior population is easy bruising on the arms. This is called solar purpura, and this is due to a combination of factors. Sometimes it's because you might be on a blood thinner, something like aspirin for your heart health, or Coumadin, or Xarelto. There's a lot of them. Plavix, clopidogrel, right? There's a ton of them. But those can contribute to solar purpura, but more commonly, it has to do with sun exposure over time, leading to the collagen in your skin becoming thin, and so the blood vessels do not have cushion from minor trauma, even like carrying a purse on your arm or a heavy grocery bag. Solar purpura can persist for a long time in people, and if you have, say, a big event that you want it cleared up for, we have a laser that can get rid of it. We also have different lasers that help with skin texture, just to help smooth out some wrinkles and things like that. All these things are available. It's just making a consultation with your doctor so you can discuss about it. These are my 3 kiddos. That's Stanley, my oldest, waving his hand. Matilda, my baby, she turns 2 next week. And then Cormac, my middle, he's 5, but he's a tank. He's the biggest. So now it's time for question and answers. I'm here to hopefully go over anything that you are wondering about.
I have a question about ointments, creams, and lotions. You can walk into the dermatology or the skin aisle, and everybody makes one of each. So when is it appropriate to use an ointment versus a cream versus a lotion?
Yeah, great question. In general, ointments are better at locking in moisture than creams, and creams are better in locking in moisture than lotions. Lotions are creams with more water added to them. In that way, they're more easily spreadable, so they're easier to cover big surface areas. Creams are a little bit more difficult, but they work a little better. And ointments, like a Vaseline, like a mineral oil or petroleum jelly-based product, they are the best at preventing water from evaporating, but they're kind of greasy, so a lot of people don't like the feel of them. So my advice would be, it depends on how dry the skin is. So maybe on your feet, if your heels are very dry, then you might pick an ointment where you'd be able to put it on and throw on a sock and it wouldn't bother you. But if your arms are just a little bit dry, and you don't want to feel greasy all day or leave prints on everything, then that might be easier to just use a lotion. Yeah.
What about the chemical makeup of some lotions? I've heard people say, or have prescribed Cetaphil, or there's another CeraVe,
Yeah.
and are those particularly better for certain things than just Jergens lotion?
Yes, great question. There is a certain portion of the population that is lacking a protein in their skin called ceramides, meaning their skin might not make enough of this. They actually have a gene mutation called filaggrin. You might be able to detect it in yourself or your children if you look at the palm of your hand and have lots of lines. You might have to compare yourself to your neighbor. But if you have what's called hyperlinear palms, then you might also be lacking in ceramides from your skin. Most of the commercially available products these days have actually incorporated ceramides into their lotions, but CeraVe which is actually for ceramide vehicle, and Cetaphil were one of the first brands that did that. So in general, if you are prone to eczema, then you might need ceramides, and those would be great products. But almost all of the drugstore lotions and creams, they're very good. They are, I tell my patients all the time, I don't think that our office carries the most superior products. The stuff at Walgreens and CVS is great. It's formulated by very intelligent cosmetic chemists. These big companies have invested a lot in studying the efficacy of their products, and they work pretty darn good. So there's a good chance if you bought one and it says, for dry skin, and it's Cetaphil, CeraVe, Eucerin, Neutrogena, Aveeno, any of those big brands, you're gonna be pretty happy with the results.
My question is how to balance protection from the sun with vitamin D3 production from UV. Now, is there can you use a UV index you get on a weather app as some sort of a guide? If the UV is index is less than, say, 2 or 3, is that okay? For how long should you be out in that? That's making the assumption that I'm covering my face and my ears and my features. Do you have any guidelines or anything on?
Yeah, I think that sounds pretty darn reasonable. I think that if the sun is bright and you know it, and that doesn't mean that if it's cloudy you don't need to protect yourself, but if you're very tech savvy, you could absolutely check the UV index. But if it's the middle of the day and it's hot, wear a hat. Just keep it easy, wear a hat. Most people, you will need, if your vitamin D is low, you will need oral supplementation, and by going out in the sun, that won't negate that. You'll still need supplementation.
Yes. But do you have any guide that's saying when you're walking, you check the UV index?
I don't.
UV, but I mean, do you have any guide on how to use the UV index?
There, if you check on your phone with the UV index, it will give you specific, if it's over this rating, stay indoors. But most of the time, if you're deciding to get out, you should just get out and enjoy life. Just slap a hat on.
Now, if you have a hat on and you have your cover, you're not going to get any UV directly to your skin.
Yes, I understand that, but I'm saying even if you're completely uncovered, you're unlikely to get enough UV if you have low vitamin D to get enough vitamin D. So you cannot really rely on your sun exposure to be making enough vitamin D.
So what do people do in ancient times?
That's what I say, it's a little bit of an environmental phenomenon. There are even cultures like in Papua New Guinea where they're barely wearing any clothes and they're having vitamin D deficiency. So.
Okay.
I have a question about the effects of antihistamines on dry skin. My wife and I have severe allergies, usually about this time of the year, and we have been taking antihistamines to alleviate the symptoms, which they work very well, but we've noticed that our skin is less moist, shall we say, drier in other words, than they were before we started taking the antihistamines. The research that I've done on the internet is a bit vague and nebulous on that, in that respect, and so I'd like to hear your opinion on the matter.
Sure. Most of the time, itch from skin is not mediated from histamines. The caveat from that is if you're getting urticaria or hives, that's a condition where you're actually having a histamine release. So it kind of depends on the cause of your dry, itchy skin. When we see improvements of itch in patients that say have eczema, it's usually because the antihistamines that we're prescribing have a sedating effect. And itch often gets worse at night. It's something that the body can kind of ignore, your neural input when you're walking around during the day, but once everything has settled at night, itch often increases. And so the sedating effects of certain antihistamines are used to try to counteract that itch. But in general, if your itch isn't driven by hives, or what's also called urticaria, then an antihistamine isn't really recommended.
Yeah, I would like to know if time spent in the car is time outdoors or indoors?
That's a great question. Your windows will filter out UVB, meaning you are not going to burn while you're in the car, but it does not filter out UVA, which is also a contributor to the sun. So we see patients who are pilots, who are exposed, in a lot of glass way high up in the sky, have much higher rates of skin cancer. And there are pictures, I wish I put it in my talk actually, a very famous one of a truck driver for 50 years. And the left side of his face is so significantly affected by photo damage compared to the right side due to those UVA rays coming through. So if you're spending a long time in the car, you need to consider that, protecting yourself.
Hi, I have rosacea, and I have been told to use very odd things. One of them is sort of a snail gel. Do you know about that product?
There's a few cosmetic snail mucin products.
Yeah, that's what it was called, yeah. And do you know anything about it? Do you have an opinion about it?
It's generally not necessarily something that's given for rosacea. Rosacea, I'm speaking generally, not specifically your medical case. But rosacea is an issue of the skin barrier being easily irritated, and then the blood vessels become inflamed. And there's actually a correlation with sometimes some GI issues. So if you have rosacea, but you're also experiencing some indigestion or anything like that, it's worth seeing if there's a connection between the two. Often there's not, but we do recommend products that repair the barrier of the skin. So moisturizing, avoiding harsh irritants, avoiding acids or scrubbing, things like that for rosacea-prone skin. The snail mucin is generally not very irritating, but most people, it's a cosmeceutical. So they're using it for effects of youth, not necessarily for treating rosacea.
The other one that was recommended was some sort of a bison product, something that was like a lard sort of. It was more,
yes, so it's very hot right now on social media for beef tallow. I wonder if that's what you're discussing. There's a lot of information out on social media there's a lot of experts on social media that are really not experts.
non-experts.
Yes, and there's a huge subculture movement back towards saturated fats. The eat red meat, use pure butter, use beef tallow, only put things on your skin that are safe to eat. I don't think in general beef tallow would probably be harmful for most people unless you suffered from acne. It most certainly could flare acne, and I'm sure you would smell a little funny if you're putting beef tallow on your face. But I think for the most part, if it's not overtly harmful, if a patient tells me they're using it, I just kind of chuckle to myself. Yeah.
I have once developed itching at nighttime, and it will be all over the body and no outside appearance. And the doctor prescribed a medication which is now called Zircon, available OTC. And
What is it called again?
Zircon?
Zyrtec?
Zyrtec, right. And after a few years, I'm experiencing it right now. And I asked the doctor, I said, well, go and get Zyrtec and see what it does. And so I'm using it the last 2 or 3 days, and so I'm yet to find out. But what is it causing it?
Well, I wish
I asked him, and he said, go to a dermatologist.
Yes, so the workup for itching, full body itching, is quite large. And what we usually do as a first step is to make sure that the organs on the inside are working properly, that there's no issues with the liver or kidneys, that there's no undetected malignancy, things like that that can cause itching. If that is all normal, then we really focus on dry skin care. We have you use moisturizer consistently, make sure that your showers aren't too hot, just like we reviewed earlier, and kind of go from there. After that, there's a lot of other options, but it really depends on your specific case.
Thank you.
Yes.
Is there a difference between vitamin D and vitamin D3?
Yes. Well, for your purposes, if you're buying a supplement, you'll probably buy vitamin D3. And it's just in general where it is in the conversion step. So that's the active form that you'd want to be taking. And I think most, again, I did vitamin D research in medical school, but the international units that are recommended, the daily dosage is, it's changing and it's thought about how much you really need to take. Some people take just 2,000 international units a day. I personally myself take 10,000 international units a day, but I am a dermatologist and very strict with my photo protection. Probably 5 would be aggressive, but it kind of depends on your own risk factors and where your baseline is. If you don't know what your level is, then it's worth getting that checked out, because that kind of dictates what you need to be taking, if you need to supplement or not.
Somebody else, can I have another? For some of the skin conditions that are not pre-malignant or possibly needing treatment by a dermatologist, and you said something about a cosmetologist, how does one contact that kind of a place if you're not looking for getting your eyebrows reshaped or Botox particularly? How does one get a competent or licensed cosmetologist to deal with some of the skin conditions that don't need a dermatologist?
I just want to ask a little bit of follow-up questions. Are you meaning like other medical dermatology conditions like psoriasis, or things that are primarily trying to just make you look better? Like aesthetic
Yes.
concerns?
Early on, you had some slides, and you said something about this is usually something that a cosmetologist can treat. I'm not talking about a particular dermatitis or something, just wrinkles or color spots, things like that.
Sure. I think the most important thing to know is that the word cosmetologist is really unregulated, meaning anybody can call themselves a cosmetologist, even if they have no training or expertise. I think most board-certified dermatologists have background and an interest in aesthetics, and you can look at the website of the doctor that you'd like to see and start there with a consultation. I know that our practice often offers free consultations on the different things that we can offer. for you. But you really have to just check out the website, and you really have to look at somebody's credentials, specifically if you're considering something like a laser. When I was in my fellowship, I had a patient in Houston who had been to a med spa, which is completely unregulated. Maybe there was an emergency medicine doctor by name, but there's some estheticians doing whatever, and they kept trying to treat a brown spot on her cheek, and it wasn't getting better, so they referred her to our laser center because we had better technology and more expertise. At least they recognized that. When she came in, I could see immediately that this was a melanoma. When she had her surgery, this tiny spot by her eye ended up needing a graft from her forehead all the way to her neck because the laser delayed treatment and it was growing under the skin. So I think it's imperative that when you get these treatments done, that you have to at least be under the care of a doctor who knows what they're doing. If they have looked at your skin and you feel comfortable and they feel comfortable and you trust them and they say, okay, I think you could do this treatment with my esthetician, like a light chemical peel or something like that, that can be done appropriately. But if you go into an office and you never see a doctor, and that happens all the time. One, it's illegal in the state of Texas, but it still happens. You should not feel bad asking the credentials of who you're talking to, because sometimes they present themselves as an expert and they're not. And don't be afraid to, ask questions and make sure that you're in good hands.
You've answered a number of questions that I had, but I have another question. My fingernails are cracking all the time. My fingernails are cracking all the time. Is there anything you could recommend to do to have fewer problems with that?
Sure. It's normal over time for everyone's nails to get little ridges in them. Where they are cracking dictates how you can help them. If they are cracks going up and down, then you can improve the strength of your nail with a nail conditioner. And the most common one I think you can buy over the counter is called Elon. It's E-L-O-N. And you have to rub the conditioner where the nail is formed. So that's right at the base of the nail on the skin. And you would rub that nightly. If the crack is at the very distal end of the finger nail, like the plate of the nail is splitting and looks more white, that's different. That can be due to a medication that you're taking, or trauma, or a few other things. So it kind of depends on what's going on with your nails. But if in general, it's all the nails, and it's just those kind of linear, kind of ridging kind of cracks, then a nail conditioner can help.
Where can I get those bathing suits that have long sleeves and long legs? I'm sure I would look better in one of those.
You know what? I wear it and it is so freeing. I actually got all of those swimsuits on Amazon. And they're, UPF 50 and you'll never get a sunburn, and they keep you cool. They do not make you feel hot. They're great.
Could you talk about fungus on toes, please, under the nails?
Sure. Living in Texas, fungus is endemic to our soil, so it's kind of everywhere. And if the nail gets any form of trauma to it, then the plate splits and the fungus can infect the area. In general, topicals to treat nail fungus are not very effective. They do not penetrate deep enough. with the exception of one commercially available prescription product. It's called Jublia, but you have to use it nightly for a whole year, and its recurrence rate is almost 80% after when you're done. So the number one way to kind of prevent foot fungus from spreading or getting worse is to make sure you're minimizing trauma on your nails, that they're kept trimmed as short as possible, and that you're not wearing closed, tight shoes where the nails could be bumping. The most effective way to treat fungus of the nails is with pills. There's different ways to dose the pills. So if you take the pill for a long period of time, it can have many interactions with other medications, and it can have a risk of hurting your liver. When most people hear that, they think, well, nail fungus is just a cosmetic issue. I'm not going to take that risk. But we know these days, most dermatologists do at least, that you can dose the medicine in a pulsed fashion, meaning you only take the medicine for 1 week out of every month, because the liver has an amazing ability to take a hit and then recover, and then take a hit and then recover. So that really minimizes any kind of side effects that you might get from the medicine and can be a pretty effective treatment. So if nail fungus bothers you, know there are treatments available.
Yes, thank you. The bathing suit question piqued this one. Golfers are out there, at hours at a time, and they're
They're
out
my
there.
best patients. I make lots of business for dermatologists.
Well, and could you speak to that? And also, does the swimsuit long sleeve, might that work, on a 1 hour, 4 hour jaunt outside?
Absolutely. So they make great sun protective clothes, including shirts specifically for golf that are very light but very tight knit to give you protection. And you can get them at places like REI, that like camping outdoor store. I make my kids wear them in the summer to summer camps. And sometimes people go, your kid is wearing a long sleeve shirt? And actually they're cooler in that shirt because it's blocking the sun. And so that's a great idea for someone who golfs. I also know people wear sleeves sometimes if they want to just throw on a sleeve underneath their normal shirt. And my favorite thing with a golfer is to always compare their hands, because you can always tell which one has the glove. It is protected and the other one has way more spots and wrinkles and things.
Anyone else? Well, thank you for spending enough time to answer quite a variety of questions. This is what our audience likes, and thank you. And thank you for the gift bags.
You're welcome.